Hi there, good morning. My name is Gerard Green. I'm a men's health physiotherapist based in the London Men's Health Clinic and our clinic in Birmingham. And we're now in mid-July, 18th of July, and we're expecting the big heat wave. And although Michael and I are both in shirts, so we are expecting in a few minutes the 39 degrees to hit us. So it gives me great pleasure to speak this morning with Michael Yates, and Michael is a clinical psychologist who specializes in many things, but from my perspective, he's an expert in men's health, and he's based at the Havelock Clinic in London. And I got to know Michael because when we started to see patients in London, we needed someone brilliant to send them to. And lots of my physio colleagues said, you need to send them to the Havelock Clinic and you need to send them to Michael and his colleagues. And we did that. And then the patients came back and said, thank you very much for recommending Michael, because he's been brilliant. He's been such a help to me. So, Michael, do you want to just tell us a bit about what you do?
Hello, and thank you so much for having me today. Yeah, as you said, so I'm a clinical psychologist, but I actually specialize mostly in working with people around difficulties with sex, relationships, and their bodies in various ways. And I guess we've overlapped because we end up working a lot with people that experience pain or other physical difficulties that start to impact their sexual and relationship life in various ways. I am a clinical psychologist, so I do also work with a kind of range of emotional distress, mental health difficulties, but focus very much on the impact that might have on somebody's sexual, emotional well-being.
Brilliant. So let's just talk in a bit more detail about some of the men that you see, particularly the ones that physiotherapists would be interested in also, particularly men's health physiotherapists. So do you want to tell us about maybe the men you see who've got issues around erectile function?
So one of the very common things that people come to me to talk about is erection difficulties or difficulties with sexual function in various ways. I see a range of men experiencing that in a range of different contexts, and I guess across the kind of age range, from young adults all the way up to people that are slightly older. I work with people who both might have a physiological reason for erection difficulties. So they may have cardiovascular difficulties, have had some kind of injury, neurological difficulties. And so there's a kind of physiological reason for why erections may be difficult, but there also is often a kind of psychological overlay to that in various ways. I also work with men who perhaps don't have a physical or clear physical reason for having erection difficulties, but actually, again, there might be like lots of psychological distress that go around that. One of the other things I also work with, and I know that we overlap a lot around, is people that might experience pain or maybe unexplained chronic pain. Again, might not be always explained very well medically, but can be hugely distressing, but again, can have a knock-on effect to sexual function in various ways.
And I suppose I see probably with particularly the pelvic pain patients is that you see some men who maybe have a pre-existing condition around maybe anxiety, but then because of the nature of the condition, that pelvic pain generates a huge amount of stress, anxiety, changes in mood.
Yeah, absolutely. And that it becomes a little bit chicken and egg. You know, the pain can come first, but then of course that causes anxiety and stress. Or we can have anxiety and stress, which then actually makes the pain worse. But often then there is an impact on then not only how we feel, you know, how confident we are, how we feel around sex and relationships, but actually physiologically on the way that the body works.
And I suppose one of the big questions I have is, you know, when do people really need to see you? So when do, you know, patients or clients make the decision, well, I need help with this, I can't manage this on my own? When should they see you really, or one of your colleagues?
I think there's probably two main groups, if you like, that tend to come through to us. The first one would be for people who perhaps have had various medical investigations already, but perhaps it hasn't quite shifted things. So a lot of the men I see would have seen doctors, they would have seen physio, they would have seen other specialists, and sometimes that works, sometimes that helps to a certain point. But what they find is that they're kind of reaching a ceiling. You know, things improve, but not significantly, and that's often a sign that there's something else going on. And usually that is something psychological. There's something going on that's making us anxious, apprehensive, avoidant around sex and relationship. And for that group, it's often at that point that they want to come and speak to someone. So the medical bit comes first, and then they think, actually, maybe there's something else to explore here. And then it's really useful to come and speak to a psychologist or someone that's kind of specialist in thinking about the psychological impact of this. The other group, I think, are people who are experiencing high levels of emotional distress and can really recognize that. And perhaps that's impacting them individually, not just around sex and their body. It might be affecting them in other areas of their lives. It's finding it difficult to function in other ways, or it's impacting your relationship, which is a very common thing. You know, it's spilling out, it's causing tension, conflict, worry within the relationship. And actually at that point, it's usually very important to speak to somebody about what's happening emotionally and how that might be feeding into the physical experience you might be having with your body. And
I suppose one thing that I've noticed has changed over the last few years is that historically, particularly around erectile dysfunction was very much seen as a condition that would affect men later in their life, maybe 50 plus. Whereas I think now, especially in the last couple of years, we're seeing lots of men in their early 20s, late teens with problems with sexual function, anxiety, kind of lacking that kind of confidence in sexual relationships. So you must see a lot of these younger men also.
Absolutely. And I think it's a bit of a myth. I think the erection difficulties affect people in their sort of 60s and 70s, and it's a kind of older man's difficulty. Of course it is for some people, but I would say the vast majority of my caseload, if I ever look at my caseload as a snapshot, most men are in their 20s and 30s, maybe early 40s. So just sort of normalize that for the moment. And I think there's loads of reasons for that. We can go into loads of detail about that. But I think there's immense pressure on men. There's often immense pressure on sexual performance, expectations around what our bodies should be doing, lots of messages we constantly get about what being good at sex is, how much sex we should be having, or how much in the mood around sex we should be continuously. And it creates anxiety. And anxiety is often the main reason why younger men experience difficulties in and around sexual function, including with erections. I think often as well, a lot of men assume there's something physical going on, and sometimes there is. I think when our bodies don't work, it is a physical thing. Our bodies aren't functioning in the way we want them to, and so we can become really worried, and then we visit doctors and we go to other medical specialties. But quite often for this younger population, the anxiety element is actually the thing that is causing disruptions in the way the brain and the body works, which makes it much more difficult to maintain erections when we need to.
And I think the other point is that if those men had something else going on with them, like they had maybe a physical injury, like a knee problem, a shoulder, something was happening at work, they would generally tell their friends, maybe tell their partner. They would, if they're out in the pub or they play football with people, they'd say, oh, well, I'm struggling at the minute because I've got back pain, or I've hurt my knee, or I'm having surgery. But generally, that's not happening with these conditions at all.
Yeah. And I think, we've come so far in our society, we're talking about lots of different issues, right? But sex remains this thing. And especially sexual function remains this thing that we just don't share with others. We don't speak to our peers about it. And I think, that's true for everyone, but I think for men particularly, it's still a taboo really to discuss. And so what happens is a lot of this is internalized. We keep it inside. That generates even more anxiety and pressure, stress, which actually all have a physiological impact on how our bodies are to function in the way we want them to in the sexual space.
And some of the men we see, they get a common symptom with male pelvic pain is post-ejaculatory pain. Mm-hmm. So so post ejaculation, they get a flare in symptoms. Now, once the pain has really settled down, and once life is a lot better and the condition is much better, a lot of those men have real kind of fear avoidance around sexual activity. So physically things are good, but they're reluctant to either masturbate or be intimate with a partner because they feel, well, when I've done this in the past, it's been really, really painful, or, you know, maybe this contributed to my problem. So that kind of fear of intimacy, fear avoidance is something common. That's something that you come across.
Yeah, absolutely, all the time. And it's important to remember what, I guess, how sexual function works, I guess, in the body. You know, in order for our body to work, and for order for us to experience all the physical changes that we want to happen, and psychological changes we want to happen in a sexual experience, we need to switch on what we call our parasympathetic nervous system and feel relatively relaxed, and be in a physiological and psychological state that allows us to kind of feel calm, safe, and engaged in experience. If we start to experience stress at any point in the sexual experience, either beforehand, or we're anticipating something that's going to go wrong, or we expect that there's going to be a negative outcome, then actually it tends to disrupt our body's ability to function at a physiological level, but also psychologically. And so what you're describing, and it comes up so often, it's really important to normalize. You know, obviously, if we've experienced a negative symptom in and around sex, the next time we go into sex, we're going to be apprehensive, right? We're going to want to pull away, or we're going to want to avoid. Normally with men experiencing this, I would think very carefully about what is the impact of pain, emotional distress after ejaculation. To think about, well, what is possible and what could we explore in terms of not only the physical side of things, but also kind of the psychological experience of being intimate and being connected. Now, for some men, that will mean that perhaps we can't always have sex in the way we want every single time. If it causes high pain or high distress after sex, we might need to rethink what maybe sex looks like, or how we have sex, when we have sex, and what that's like for an individual. But we'll often be working with someone to think about how can we break down that kind of automatic cycle that starts to kick in, where we expect something to go wrong, then we feel stressed, then we feel anxious, then our body doesn't work, and then we feel more anxious and stressed because it didn't work.
That cycle. Absolutely.
And because for many men, although we fear an outcome, or we really worry about what's going to happen after sex, sometimes there are possibilities to do certain things, or to go part way, or to explore other forms of intimacy, or to engage with our bodies in different ways in order to still be connected, still feel sexual, still build intimacy into our relationships, but also to sort of better manage the experience of physical pain and distress as you go forward.
And it's safe to say that pornography has changed in that so I've got 3 teenage boys, 15, 16, and for their generation, there is easy access to pornography everywhere compared to, say, my generation, or even people younger than me. So with some of our patients, but it's just some of them, they will say that, well, some of my problems maybe were contributed to, I feel I use too much pornography, and I feel I got too kind of hooked on that. I needed that. So it's quite a difficult thing to get help with, because people are, I think, reluctant to seek help because they don't really know where to find help. It's a difficult thing to discuss with kind of friends. So are those men that you see also?
Absolutely. And porn comes up, you know, almost every discussion that I have with men around this. Now, the first thing to say about that is that actually, you know, there is very little evidence that using porn will cause any of the functional difficulties that you or I will see with men in the room. And I think that's important to note, because I think there are some myths out there around, if I use too much porn, I'm going to damage my body, or it's going to cause erection difficulties or other physiological difficulties. I think the evidence on that is pretty poor. I don't think that is the case. And porn is pretty ubiquitous. So, whether people are talking about it or not, I think recent studies on pornography show something like 90% of men use porn, at least once every month. So, I mean, it's everywhere. And for most of the people that I see, particularly sort of younger men in their 20s and 30s and 40s, it's inescapable, right? It's part of our culture. So I would think with somebody about what the function of porn is and, what it brings them, why it's helpful. And for a lot of people that have experienced maybe pelvic pain or have worries about sexual function, porn can be a great alternative. It allows you to have an outlet for sexual function, it allows you to have some enjoyment and sexual pleasure, but of course it doesn't come with the pressures of having sex with a partner.
Yeah.
Usually in our discussions around porn, what we're thinking about is how do we create a better balance for you, whatever that means. How do we create a situation where you're able to perhaps engage in porn in a way that might be helpful, bring pleasure, allow you to kind of engage in things that build fantasy, but doesn't take away from your ability to be able to experience sexual pleasure and enjoyment with partners or with your own body in other ways. And it's thinking about creating a balance and more flexibility around how porn fits into a much bigger picture of sexual experience, sexual connection, sexual enjoyment, that actually allows people usually to feel much more comfortable with porn use.
And I think also for lots of these men, it's quite both reassuring and a relief when they find someone who is happy to discuss these things with them.
Absolutely. And I think one of the first thing I would do with anyone that comes into the room with me or with any of the team would be to think firstly about how do we just break down some of those barriers about talking about this. It's important to acknowledge, if you come and speak to someone about this, it can feel uncomfortable, it can feel unusual, it can feel really anxiety provoking in itself. And so we do quite a lot of work to help people to kind of think about the language they want to use, the words we want to use to describe their body and sex, and also to be really clear that we take no position on what's right or wrong in a sexual experience.
It's their normal.
Right. There isn't a right way to use your body. There isn't a right way to have sex. There isn't a right amount of sex to have. But by breaking that down at the beginning, we hope to help people then to think about, well, what is right for you? What is it that you want? How do you want to talk about this? How do you want to approach this topic? And in doing that, hopefully, we help people to actually explore what they need and what's going to be helpful for them at this point in their journey.
And not putting you on the spot here, but lots of these men spend a lot of time online looking at resources and looking about their condition, and sometimes they just almost become a little bit obsessive about seeking information. So are there any good resources that you would confidently recommend for some of these men, particularly around their relationship with pornography, that might be useful to these?
There's a YouTube channel called amaze.org. You just search on YouTube, and I'll caveat it as in it's pitched slightly to a younger audience. So I think a lot of my younger patients really respond to this, but it's actually got videos on all sorts of things to do with sex and sexuality, but it's got particularly good videos on porn and porn use and what's normal and how to manage porn use and how to think about using pornography in different ways. I would recommend it. I think it's useful for everyone. And I think it gives some kind of simple, manageable and basic info that's quite reassuring. So check it out because it's quite useful.
Brilliant. So that's amaze.org.
Yeah.
Super. That would be really useful for people to look at. Another group of men that we see lots of in both in our clinic in Birmingham and in London is some of the older men, usually probably 60 plus, 65 plus. So they've had a diagnosis of prostate cancer. And a lot of the men we see, they've had their prostate removed, so they've had a prostatectomy. And all of those men, 100%, they get two things. They become incontinent of urine. So after surgery, they go through a long period of having to wear initially big kind of nappy type pads, and then they have to wear pads, so they're leaking urine. And so that's the first thing. And if that's not bad enough, they also get quite profound erectile dysfunction. So these men go from being, active, working, playing golf, tennis, looking after grandchildren, being in active, healthy relationships, traveling, to suddenly they're now at home, they're having to wear pads, they're leaking, they've got very little erectile function. So what I see and what the evidence supports is these men can get real loss of confidence. They can get really this feeling, loss of manhood. They can feel quite fragile, anxious, stressed, which then changes into maybe changes in mood and problems with, they don't socialize, they don't go for dinner with friends, problems with relationships. So this is a big group of men we see. But with those men, they don't initially tend to get much help, in that the focus tends to be very much on the diagnosing the cancer treatment, but then they're kind of left a little bit to fend for themselves. There are exceptions to that, obviously, but they're left to fend for themselves a little bit. So what can we do in terms of psychological support for those men?
Yeah, this is really important. And one group of men that I think are underserved, as you alluded to there, with particularly with psychological therapy, but often with other types of support. I guess up to now, I've been talking a bit about sexual function and the role of anxiety, and we're often targeting anxiety, right, in psychological therapy to try and reduce anxiety and see if we can improve the physiological response within the body. With this group of men, although that can still apply, and then there may be a role of anxiety that will actually be making things worse, and if we reduce that, then you may regain some form of sexual function. There's also acknowledgement here that they've been through something very profound.
Yes.
And so with this group of men, actually, the work becomes much more focused on adjustment and around loss and understanding, perhaps, yes, what's been lost, and having space to acknowledge that and being able to work that through. Because again, as you said, a lot of people don't talk about this. And especially if we go into remission, the narrative often becomes, well, you're in remission, great, you've got over the cancer, brilliant, go and get on with your life.
Well done.
But no one says, but by the way, you won't be able to have sex again, or by the way, you won't be able to do certain things. But we're expected to kind of celebrate the fact that, you've got over the cancer, so why is there any other problems? And so we give space to that. We give space to that, and acknowledging that there are probably things that we need to come to terms with around how our body has changed, how that impacts functionally our ability to engage in the world around us. But we'll also be thinking about, well, what is possible now? For a lot of these men, they've lived their whole lives having sex in a particular way. They have a particular image of what sex is, how you do it, what's expected of you as a man, the role you take in sex, what partners expect, how frequently you do it. But sometimes that needs to be sort of rethought in some way, or reframed is maybe a better word. For a lot of these men, the work we actually do is end up thinking with them about, well, what could sex look like now? Even if we don't use our bodies in exactly the same way, can we still have intimacy? Can we still have sexual pleasure? Why are we doing it? Why do we still want sex? Often we want sex because we want to feel close to our partners. We want to have enjoyment. We want to have fun. Well, are there other ways of feeling those things?
Yeah.
Using our bodies in different ways and exploring sex perhaps in a slightly different way.
And I think within the physio community, especially the physios who see these men, we try and maybe shift that focus that it's got to be very much penetrative focused. And for a lot of men, especially post-surgery, they feel, well, I can't have sex as they see it until I can successfully, especially if they have a partner, until I can successfully maintain an erection to penetrate. But if they wait until that point to start, that's a long time away.
I agree. And actually, I mean, this actually goes for all of the work we do. I mean, I even have these discussions with my younger men who haven't had any of these physiological problems. But I think there's something about the way that we privilege penetration and how we define sex quite narrowly often around penis and vagina or penis and anus sex, that as being that is what sex is. Actually, it's useful sometimes to take a step back and think a little bit about why are we having sex and what does sex even need to look like? Because often we can get an awful lot from a wide range of physical experiences that we may have with our own bodies or with with our partners, that actually doesn't need to involve penetration all the time. It doesn't need to build up to penetration in kind of this kind of climactic way. And what's really interesting, particularly with this cohort of patients, especially these kind of older patients that have had physical health difficulties, I often bring the partner in to the work. So we often will work together. And often, almost always, the partner will reflect something like, I don't need to have penetration in order to have pleasurable sex. I enjoy other forms of connection with you. I'm actually looking for other things from sexual connection. But actually, the narratives around masculinity and the ways in which men,
and those are powerful because we see patients with partners as well. And those are quite powerful conversations.
Yeah, it can completely reframe the position, but it's hard for a lot of these men to get out of this position. It's understandable. We've lived our whole lives being told that's what you're supposed to do. That's what men do. That's what the role men take in sex. And so to suddenly change that is really, it can be really overwhelming. But ironically, often our partners often don't see it that way. And having those conversations can free us up maybe to start to use our bodies in different ways and not to lose everything around sex, not to lose everything, even if it can't be exactly the same again, even if it isn't the same in the long term.
Now, we reached out both to our physiotherapy clinician audience and to patients. So we have some questions for you, although you have answered some of them already. So this is from one of our physios in Iceland. We run courses, so we have people from all over the place. So if someone comes to see you and they have erectile dysfunction, how do you decide that there is a psychological component to that? I think you've touched on this before.
Yeah. So basically, I mean, just to say, I will always be thinking about physiologically what's happened for somebody first. So if someone comes to me and they've never seen a doctor or they've never been to any physio, they've not had any physiological impact, we'd normally be encouraging them to do that initially, just to rule out, medical.
And it's these men have, and so it's by the time, I may be wrong, but I would think by the time these men see you, they've seen a lot of people.
Usually. And so what really the decision that I'm often taking is I want to understand a little bit more about what is the psychological impact of this. So how does somebody feel now in the build up to sex, around the idea of sex? And also, what are the expectations that are starting to be kind of built in to the experience of sex? Many men I see will already be preempting that it's going to go wrong, that it's not going to work, that their body is somehow, doesn't work the same as other men, that there's going to be a kind of failure that happens. And I'm often picking up in an initial session around what are the experiences of anxiety, stress, and pressure around sex. And if there are sources of anxiety, stress, and pressure, then I'm thinking with someone then about how has that developed over time? Is that something that's just suddenly come on? Has that built up over time in conjunction with the physiological difficulties? And through that, then I'll make a decision around actually how much maybe is anxiety contributing to this problem, and how useful would it be if we could reduce anxiety in helping you to feel more relaxed and perhaps allowing your body to work in a different way. So I'm always on the lookout for that. It's the assessment of anxiety and emotional distress that helps me make the decision around whether somebody needs therapy.
Brilliant. And then a patient question is that if a lot of the patients with pelvic pain can have it a long time before they find someone that they're confident in seeing.
Mm-hmm.
So the question is, I've had pelvic pain for many years and I've got stress and anxiety associated with that. But because I've had it for a long time, is it still of value to get the psychological components addressed?
Short answer is Yes.
Yes.
And the reason for that is because although the pelvic pain is a condition on its own, it's something that needs to be managed medically, and we really need to pay attention to that. The anxiety and stress that you're understandably experiencing can act a bit like a volume dial, where it can amplify our symptoms over time. And the reason for that is partly because when we experience anxiety, that can actually increase subjective sensitivity. It can actually make us feel a more intense experience of pain, but it shifts our attention. If we're anxious, we're more likely to pay more attention to pain. We're more likely to be sensitive to sensations in and around the genitals and other places. So working on that, or talking about that a little bit, or perhaps finding ways of better managing anxiety, might not remove all the symptoms. It might not resolve the whole problem, but it sometimes can turn that dial down a bit and help you to manage better. So it's always useful, no matter where you are in your experience of pain over time.
Now, the next question will probably be one of the easiest questions you'll answer all week. I should know the answer to this because we've sent you lots of patients and they all say it's amazing. But and I know you work online, but where in London is the Havelock Clinic?
It's in two places. So we have a medical clinic on Harley Street. So if anyone needs anything there, you can go to Harley Street. I'm actually based in Shoreditch. So that's sort of East London, between Old Street and Shoreditch. And I see people in person there. So we do in-person work. And we can do online as well. So we work around whatever.
And what do you do mostly? What's the split online between face-to-face?
I would say it's about 50-50 now. Obviously we had COVID and we had to move completely online. But I was keen to get back to face-to-face. So I've always offered that really from whenever we've been able to over recent years. And so now it's about 50-50. And I think people just make choices based on their life and
and I suppose how comfortable they are speaking about these things when they're at home.
Absolutely. And some people prefer that because it's their own space and they're safe. Other people want to come into the clinic, and I really promote that. So we do both, and we will continue to do both as we go forward from here.
I think a trend I've seen, we don't do as much online now. We do, I don't know, maybe 1 or 2 a week. We did lots during COVID, but what you would find is the men who are really a bit reluctant to talk about things initially, they would do the online from their car.
Yeah, absolutely.
So they weren't at home. They were in the car, which says a lot. Now, I'm mindful of the time because we are in the middle of the heat wave, and they've said if we're in a room with a screen for more than 40 minutes, we might evaporate in 37 degree heat. And so just to finish then, what do you enjoy doing outside of work, and what do you do to relax? Because you obviously have quite a busy job.
For me, I have 2 children, so there's not that much time to relax all the time. But for me, I guess the priority is doing things that just help me to feel a bit more grounded. So I enjoy exercise. I enjoy going out into the country with the children. I enjoy kind of taking them to different places, and we try to just to do things that switch off. Maybe not in this heat, but normally outside adventures, doing things in different places.
Well, I must say that we talk a lot about switching on and the parasympathetic nervous system to get relaxation, which helps sexual function, bowel, bladder. And I think you are one of the most parasympathetic enabling people I've ever met, because that was a really relaxed conversation. We covered a lot, and I would just like to say a massive thank you both for doing the interview this morning, but also a big thank you for really making it a lot easier for the work myself and Sarah do in the clinic in London, because we now can say to these men, well, you would benefit from seeing Michael or one of his colleagues. So thank you for that also.
Well, thank you. And thank you for having me. And I think it's an important area, and I think it gets overlooked, but something that I think a really joined up approach, working physiologically and psychologically, can make such a big difference to people experiencing these difficulties. So it's great to be able to talk about it.
And patients, I think they will see someone, or they're more likely to see someone if you can recommend them and say, I know this person, they're very good, you should see that person. Whereas I think a lot of people may, because they probably don't have those networks, they'll say, well, you need to see a clinical psychologist. maybe try and find one online, but that doesn't, that it's a bit like, you know, you need to see a physio, find one online. Well, that's tricky. So thank you very much. Enjoy the rest of your day, and I'll put up where people can find Michael. I'll put up the link to the Havelock Clinic.
Right. Thank you.
And a big thank you also to those people who sent in questions to us, and also for those people who've been watching or listening. Thank you, and enjoy your day, Michael.
Thanks so much.